Dear friends, welcome back to Curious Vet. I am Dr. Mosina. In today's video, we will discuss about a viral disease in birds, mainly psittacines. So let's begin the topic for today, Psittacine beak and feather disease. Psittacine beak and feather disease or Pbfd is caused by a psittacine circovirus. The virus was first recognized in the 1970s in cockatoos with beak and feather lesions. You can see the picture of a beak lesion here. Since then, it has been recognized in most species of parrots and also in passeriforms and columbiforms. Diagnosis is based on clinical signs and results of PCR testing. Treatment is supportive care. Due to its contagious nature and terminal outcome, humane euthanasia may be warranted. Control involves strict hygiene, testing, and quarantine of all new birds. It primarily affects young parrots, and infected birds are presented with abnormal feathers, beak lesions, and immunosuppression. Infected birds shed virus in their feathers, feather dander, feces, and oral secretions. You can see abnormal development of feathers here in this picture. Transmission occurs mainly by inhalation and or ingestion of the virus, but can occur vertically as well. The virus is very stable in the environment, so fomites are a notable source of infection of Pbfd. The name is not as representative of the current typical clinical presentation, that is Pbfd, Psittacine beak and feather disease, because the current typical clinical presentation often does not include beak abnormalities and is less likely to have the severe classic feather abnormalities seen in cockatoos when the disease was first documented. Use of screening PCR assays has greatly decreased the prevalence of the virus in captive bred Kakatoa species. However, the disease is still seen in African grey parrots, eclectus parrots, lovebirds, lorikeets, and other species, but is rare. The natural selection appears to occur primarily in juvenile birds, with few instances of clinical infection seen in birds more than 3 years old. So, the typical natural infection appears to occur primarily in juvenile birds. Now, let's see the clinical findings of Pbfd. In the classic Pbfd infection, the first indication of the presence of disease is a lack of powder down on the beak. The virus causes abnormal formation of growing feathers and immunosuppression. Feathers are pinched or clubbed at their base and may have hemorrhage within the developing shaft, as we can see in this picture here. That is hemorrhage within the developing shaft. Here you can see Pbfd in a lesser sulfur-crusted cockatoo showing a general loss of feathers on the trunk and neck. The pin feathers on the neck are not emerging. The feathers fall out easily and grow back slowly or not at all. The distribution of affected feathers depend on the age of the bird and the stage of the molt when infected. Pigment loss may occur in colored feathers. The bird may live with these lesions for months to years. As the disease progresses, the immune system is affected as well, and most birds die of secondary infections. A peracute form of the disease occurs in young birds which develop enteritis and pneumonia and loss of weight and final death. So usually, in most of the cases, the birds affected with Pbfd die with secondary infections. African grey parrots may develop a pancytopenia because the virus attacks the bone marrow. These birds die suddenly with viral inclusions in the thymus, bursa, and bone marrow. So, only African grey parrots are found to develop pancytopenia because the virus attacks the bone marrow. So, this is a red-fronted parakeet showing extreme loss of feathers attributable to the chronic form of Pbfd. You can see abnormal feather morphology represented by white arrow, then severe feather loss over 50% of the head and hemorrhagic feathers. Now let's see the diagnosis of Pbfd. Diagnosis of Pbfd is based on clinical appearance, results of PCR assays of feces, feather dander or blood, and biopsy of affected feather follicles showing basophilic intracytoplasmic inclusion. So, biopsy of affected feather follicles showing basophilic intracytoplasmic inclusions. This is a photomicrograph of a section of a feather showing basophilic viral inclusion bodies, just shown by arrows, marked by arrows, typical of infection with Pbfd. So these are the basophilic viral inclusion bodies intracytoplasmic. Testing by PCR assay may detect infection in birds that still appear healthy. These birds may subsequently become ill or may mount an effective response to the virus. Because of the stability of the virus, PCR analysis can also be used for environmental testing. Quarantine and retesting are recommended for PCR positive asymptomatic birds. At necropsy, affected birds often have no gross lesions internally, but intranuclear or intracytoplasmic inclusions may be seen histologically in the feathers, bursa, thymus, liver, or other organs. Now let's see the treatment and control of Pbfd. There is no specific treatment for Pbfd, and treatment of infected bird is just supportive care. The contagious nature of Pbfd and its generally terminal outcome in clinically affected birds warrant isolation and eventual euthanasia in most clinical cases. Strict hygiene with attention to dust control, screening protocols including PCR testing of both birds and the environment, and lengthy quarantines are highly recommended in breeding facilities with susceptible species. All new susceptible birds should be retested before introduction to the aviary. In infected breeding colonies, removing all eggs for cleaning and artificial incubation may also be required. Since the development of a PCR assay, prevalence of the disease has decreased. Now let's see the key points once again. Psittacine Beak and Feather Disease or Pbfd is caused by a Psittacine circovirus. It primarily affects young parrots. Infected birds are presented with abnormal feathers, beak lesions, and immunosuppression. Infected birds shed virus in their feathers, feather dander, feces, and oral secretions. Diagnosis is based on clinical signs and results of PCR testing. Treatment is supportive care. Due to its contagious nature and terminal outcome, human euthanasia may be warranted. Control involves strict hygiene, testing, and quarantine of all new birds. So that's all about Psittacine Beak and Feather Disease caused by Psittacine circovirus. So if the video is useful and informative, please like it and share it with your friends. Comment your suggestions. If you are new to this channel or not subscribed yet, please subscribe and click the notification bell so that you get notified every time I upload a video. See you soon with another video. Thank you.